There's a myth going round town that when you get older you just sit down and start rocking, just rocking. In a way that's true if you know what I mean. Just take a look at the senior scene. Well, it's rocking. Yeah, it's rocking. We're pulling our weight, learning the code, clicking our heels, sharing the load, and every so often we're hitting the road. Yeah, we're rocking. Well, I must be going, got a game at 3, then kids to be tutored, they're counting on.
I'm Katherine Leith of the Orange County Department on Aging, and today we're very lucky to have Dr. Ingrid Luo-Tseng with us, and she's in rehabilitation medicine, and I'll let her tell us more about what she does in the background, and thank you for coming, Ingrid.
Thank you for having me.
Appreciate it.
I'm a rehabilitation medicine specialist, and I work with folks with osteoporosis, musculoskeletal disorders, movement disorders, and I'm currently here in Chapel Hill doing private practice and on staff at the Durham Regional Hospital.
Mm-hmm. And did I also remember, too, pain management as part of the area that you cover?
Yes, I do.
Yeah, which is fabulous. But today we're here to talk about osteoporosis.
Yes.
And just grand. What does the word osteoporosis mean?
Osteoporosis really means porous bone. So it means bone which is thinner, which is more brittle, and it has less calcium and phosphorus, which are minerals, so it's less dense than normal bone.
Mm-hmm. And how do people get it? And are women more likely to get it?
Exactly. Women are 8-2 more likely to get it. So 80% of patients who have osteoporosis are women. 20% of them are men, which goes to show that men can have it. It's not purely a disease of older women. It's also more common with folks who have a family history of osteoporosis. It's more common if you have been smoking, if you're thin, if you've had something like a hysterectomy because of or early menopause, and it also could be secondary to another medical illness that could cause osteoporosis.
Okay. And does it have anything to do with your bone structure? It seems to me I've heard people who have slight frames are more likely to get it.
The literature shows that folks who are thinner tend to have osteoporosis than patients who are obese. Mm-hmm. So in osteoporosis, it's good to be obese because the risk of falls is less and the risk of osteoporosis is less, which is unusual.
Yes, and I wouldn't say overall it's good to be obese, or maybe no, doctor, so we can't claim that.
That's what the literature says.
And are there different types or levels of osteoporosis?
Yes, there's 2 kinds. There's one called osteopenia, which is a milder form of osteoporosis. Mm-hmm. Osteoporosis is where you have marked decrease in the bone mass and mineralization of the bone.
Mm-hmm. I think you've brought some models, and
yes.
You can first show us what normal bone looks like.
This is how normal bone looks like. This is a vertebral bone model, and you can see over here that it's got thicker bone on the outside, and it's got like spongy bone on the inside. This spongy bone helps support your spine, and if you compare with this one, this is an osteoporotic vertebra. Same kind of bone, but if you can compare, you can see that it's a lot shorter, and that's because it's compressed, and it's a lot thinner, and there's a lot less bone in between. So this is a lot weaker, a lot more delicate, and as we say, osteoporosis, more porous, more likely to break.
And that's why people lose height.
Yes.
Often. And why do people get stooped? And you hear the dowager's hump can be an indication.
Well, folks can get stooped because here's an example of your vertebra. These are the actual bones, and here are the discs that keep are in between. Now, when you have osteoporosis, it tends to cause little fractures in the anterior aspect, the front part of the bone, so that it scooches forward. So you get this kind of kyphosis or hump. And that's why when you have osteoporosis, if you have a fracture, compression fracture, it tends to come with this kind of configuration.
What can people do to find out if they have it? How do you tell, or does one tell, if they have osteoporosis?
Well, there are a couple things that you can look for. For instance, if you notice that you've had a loss in height, in other words, you're more stooped than normal, if you're shorter than you used to be, or if you've got some pain in your back that doesn't seem to go away, those are some indicators that you might have osteoporosis. Other things we want to look for are, does your parents have it? Is there any family history of osteoporosis? Or have you had any surgery such as a hysterectomy, which could give you osteoporosis as a side effect?
Are there any tests that the doctor might be able to?
Yes, there is a very good test for osteoporosis. It's called a bone density, and it's a test that doesn't hurt you. It does involve a little bit of radiation, and it's done in less than 1 hour. Basically, you lie down, and they check to see the density of your bones in certain places, such as in your spine and in your hip, which are the most important places to find out where osteoporosis might be. And it tells us how dense your bones are. If it's, for instance, is it normal, is it low, or is it very low? And this bone density is also often paid for by Medicare.
And as I remember, they were talking about, you referred to being heavier is better, that when you're young, that the walking you did or the weight-bearing exercises. And you want to talk about that. It may be too late for a lot of us, but people have children and grandchildren. And I know there's a concern in general about children being obese or spending too much time in front of the television. Parents drive them to school and so forth and so on, so they don't get that opportunity to walk.
Well, the way the bone works is that the more stresses you put on bone, the stronger it gets. That's the way it is. So if you walk on your bones, walk on the ground, not walk in water, for instance, because if you're doing it in water, the water helps support your weight and it's not weight bearing. But if you walk on land and you do stair climbing, Stairmaster, those are very good exercises to help build your bones. And if you want to, for instance, have hand weights and just do your regular chores, that's one easy way of doing it. You don't have to use anything too dramatic to help your bone health. And there's also some things that you might want to watch out for. You might want to watch out for certain movements that could make, if you're already osteoporotic, at risk for a fracture. These movements include bending forward, twisting, touching your toes, doing crunches. Those are all things that you want to be very careful about.
Can you show us on the model you have?
Sure.
Of the back, what that does too?
What happens is that this is a model of your spine. These are the vertebrae. And what happens is that when you do crunches or when you lean forward, it puts a lot of pressure on the edges, the anterior edges of your bones here, and you're more likely to have a fracture there. And that's why you want to be careful about doing those kind of exercises, especially if you know that your bone density is down. And the converse is good. If you try to go this way, extending, which is why I can show in the model, you can see that this way it doesn't seem to cause the compression or the fractures.
Is that because the back is stronger by going backwards?
It doesn't.
As opposed to forward.
It's the body seems to handle it much better that way.
I know some people have to be very careful doing such ordinary things as making a bed.
Yes, unfortunately.
Yeah.
Or sneezing. There are lots of reports where if someone just sneezes wrong and poof, they have a fractured rib, and now they know they have osteoporosis.
You mentioned carrying hand weights, and I guess you can get some probably that go on your wrist to leave your hands free. And you would talk to your doctor to find out how heavy they should be. I know people even use cans of soup. Aren't they about a pound or something?
That's true. Yeah. Or if you have a lot of arthritis and your hands can't grasp those weights, what I've told my patients to do is use a backpack, and then you can put some weights in there and just walk with that as a way to get weight bearing without hurting your hands.
And the backpack would be especially good for the spine.
Exactly. And a backpack is good because you can put the weight more evenly over both sides, which is nice.
Good. We were talking about when encouraging younger people too children, grandchildren to walk.
Yes.
Because they're building the bones, is that correct?
And if bed rest is something that all of us should try to avoid, because as I mentioned before, the bone needs stresses in order for it to be strong. And if you have bed rest like an astronaut, or if you had back pain and you're just lying in bed because you're in pain, the bone itself starts losing its strength, like about 2 to 5% every day. So if you're out for 10 days, you're out 20 to 50%, about 20%, which is significant.
Mm-hmm. Can you do something to build it back up?
Yes, you can. You could be active, to do exercises. You go to your doctor to get a good therapist who can do that for you. Mm-hmm. Also, you can use medications to help build up your bones if you're osteopenic or osteoporotic.
Mm-hmm. And what are some of the medications?
Some of the medications include the bisphosphonates, also known as Fosamax, and this is a popular medication which increases bone density and reduces risk of fractures. However, when you take it, you have to be careful because it can cause some irritation of your esophagus. Mm-hmm. But I understand that you've tried it for many years and it's mm-hmm. worked well for you, so it's a very good medication to take for osteoporosis. Mm-hmm. I'm sorry.
No, I was just going to say I measured the water when I first started taking
mm-hmm.
it to be sure that I was getting enough
water to wash it down.
Mm-hmm. And you do have to stay upright for 30 minutes before you take more medications and so forth.
Exactly.
Okay. And then you said that there's a new product on the
Yes, there's a new medication out. It is a parathyroid hormone analog, which in other words, parathyroid hormone is one of the hormones that our body makes, and it regulates calcium, and it helps increase the levels of calcium into the bone, which is great for osteoporosis and help build bone. And this is a medication which is approved by the FDA for osteoporosis, and I've looked at the literature and I've noticed that it gives the greatest increases for the bone densities after treatment, and it shows promise because it seems to give formation of better bone when compared to other kinds of medications for osteoporosis. One, I wouldn't say drawback, but one thing about it that you know about this medication, its trade name is Forteo, is that it is an injection, and it's something that you can learn to inject yourself, but that is something that is a significant hurdle for some patients, mm-hmm. especially those who don't have very good hand and eye coordination or vision.
And as always, people should check with their own doctors.
Exactly.
Because we were saying people are individuals, and they're on different medications.
Of course.
And everyone's different.
There is a very good website. It's osteoinfo.osteo.org, mm-hmm. and it's wonderful for all the different osteoporosis information, updates, research, pamphlets on how to do exercise, gives you information about other medications that are available for osteoporosis, and it also gives you other overview for support systems, support staff, and other things that you could use.
Mm-hmm. And there was a telephone number too, an 800 toll-free number. 1-800,
and I don't recall the first 3 digits, but it is BONE. Mm-hmm. And that's the National Osteoporosis Foundation in D.C.
Mm-hmm. That's good to have too, because a lot of people don't have computer access.
Exactly. So I put both down. So you have something through internet, or you can use something through the phone.
Right. Now, we were talking about foods. Mm-hmm. Can you tell us what are good foods to take and how much calcium we should try and...
Well, recommended calcium for someone who has osteoporosis or osteopenia is 13 to 1,600 milligrams each day. What I tell my patients is to just look at the backside of anything that you're eating just to see what, like for instance, how much calcium does your cereal have, or how much calcium is in that box of yogurt, and see if that can add up to the 1,300 to 1,600 each day. Some top picks for calcium are orange juice with calcium, milk, yogurt, cheeses, tofu, and and sardines with bones. Those are like the top 6 items that are highest in calcium. And you can always check on these on the internet, or if you go to the library, you can find out lists of other foods that you might want to try that can increase your bones.
Did you say broccoli? Was that on the list?
Broccoli is also on the list. Yes, it is also on that list.
How about salmon with bones? Is that
salmon with bones is good. I remember the sardines wins over the salmon by 75 milligrams or so, but they're both good.
And you were saying that there's a new milk product.
Yes. I just had a baby 2 months ago, so I was drinking 2 gallons of milk every week, and so I noticed that some milk actually was fortified with extra calcium, and that was wonderful because instead of having to drink 6 glasses of milk every day, I only could drink 3 glasses, and I was done with my daily recommended allowance. So I would highly recommend you take a look to see what's on the shelf and see if you can use the milk or the calcium-enriched orange juice.
And the 1,500 number, is that across the board or for people over a certain age? Or
across the board for everyone who is osteopenic, osteoporotic, or expecting or breastfeeding.
So that's a good thing to.
Yes, it is. It's wonderful.
Incorporate.
Exactly.
Yeah.
And if you're lactose intolerant, then there's ways to get your calcium. You don't have to stick to dairy products. You can use tofu. You can eat. You can drink those calcium-fortified orange juice instead, and watch the rest of your diet.
That's great. And I guess some people write it down so that they can remember what they've had and keep
a little diary is very helpful, because then when you show the physician what you're eating, then we have a better idea of what your actual intake is, because some of us don't really pay attention to how many ounces of cottage cheese or
That's right. Yeah, I know when I went to have my bone scan, they asked me, did I drink how much milk and how many other things, and I had no idea. I probably put down the wrong things because I was getting my yogurt out for breakfast, and then I thought, I didn't put that down.
Oh, it's
but
good.
better to be eating more than.
So you're getting more than you were saying, which is
That's
great.
Right. Yeah. If you have osteoporosis, is that painful?
It's oftentimes painful.
Is that particularly if you have it in the back?
And especially if you have a compression fractures, those are notoriously painful. And again, if you feel that, if you're suspecting that this is happening, go see your physician or a specialist to have it evaluated and treated.
Because there are things that can be done for the pain and pain management.
Yes, there is. There is something called calcitonin. Calcitonin is a hormone which, again, regulates calcium in the bones, and it increases the amount of calcium in the bones. And it has another effect where it works on the pain receptors. So if you have a lot of pain from a compression fracture from osteoporosis, the calcitonin has been shown to be helpful for that. It comes in a spray form, so you use it as a spray, and it's often well tolerated, very few side effects.
And as I remember, for people who can't take Fosamax, that was a thing. And don't you just spray it in alternating nostrils?
Once a day, yes. That's how it's used.
That's right.
It's better for maintaining your bone mass and helping with pain, but I've noticed in the literature that it doesn't increase your bone mass that much. If you want a greater increase in your bone mass, there's another medication called Evista. It's a selective estrogen receptor modulator, and it's very good because it allows your body to help build up bone like hormone replacement treatment. In the past, it has been used as a way to help prevent osteoporosis. However, these hormone replacement therapy had a dark side to them. They have a lot of side effects, which included a higher risk of breast cancer, higher risk of heart attacks, higher risk of stroke and of blood clots and problems to the lungs. So the hormones are now sort of out of favor, but instead there's Evista, which is like a hormone, but not completely. It has the good side effects, fewer of the bad side effects.
And this would be for women who take Evista?
Women who can take Evista for osteoporosis.
And Fosamax can be taken by men and women?
Yes.
So That's good to know. Now, we're talking about calcium, and even though people like me are on Fosamax, I was told to still take the calcium.
Yes.
And what's the difference in the different pills?
Well, in the market, you probably see calcium carbonate the most. Calcium carbonate is basically chalk, and it is calcium. However, the absorption of it is not very high, and I would prefer to not take the calcium carbonate. There's another kind called calcium citrate, which is bound to citrate, which has a better absorption, and I feel this one you might have a better result with calcium citrate. The biggest problem with calcium citrate is it might cause some bloating, and it is more expensive than the calcium carbonate.
And again, you would need the 1,500 milligrams.
Yes, the 50 milligrams a day is what you want to get.
What about taking them all at once, or should they be spread out, and should they be taken with food?
Usually we would like people to take calcium in divided doses throughout the day, and to take it with food, since it increases absorption.
So if people took one at breakfast, one at lunch, and one at dinner,
that would be good. And not to forget vitamin D. Vitamin D is very important too, and you want to take 400 international units of vitamin D with your calcium. So the best thing is if you could find one that has the two of them together, then you have to take 2 pills.
Oh, that's good. And the food's very important, because I know sometimes you can see that the pill hasn't dissolved. And
that's true. That's why the calcium carbonate, I'm a little bit leery of, because it's chalk, and you stick it in water, 2 hours later it's still there. So, so it's. I'm hoping I like the calcium citrate as a better form of calcium.
That's good. And you mentioned preventing falls. Do you want to talk a bit about that? Because falls, if we have weak bones in a wrist or hip or someplace, that would be especially vulnerable spot.
Falls are important because if you have osteoporosis and you fall, there's a high chance of getting a fracture, and fractures really decrease your standard of living. In other words, if you're able to walk after a fall, it's harder for you to walk. Before a fall, you might have been able to do your dishes, live by yourself. After a fall, maybe you'd be forced to have someone stay with you and help take care of things for you. So it really decreases your quality of life, and falls can be prevented in many simple ways. For instance, don't have anything on the floor that clutters, no objects on the floor, no throw rugs, because throw rugs can cause people to trip and fall. Other things you want to avoid is poor lighting. And if you notice that your vision is as good as it was before, go see your eye doctor to get your eyes checked, and so that if you have poor vision, that can lead to falls. Also, if you're taking sleeping medications, they can make you sleepy and not really notice what you're doing, and you could fall from that. Or if you have a balance disorder, or any weaknesses in your legs so that you're not as steady as you used to be, that can be a reason for falls.
I would suggest, you mentioned sleeping, that especially if people have animals, night lights can help people too.
That sounds like a great idea. Night lights, or glow-in-the-dark clothes.
There you go. Or glow-in-the-dark outfit, cat collar. Yeah, there you go. But also, people use walkers. They should really use them. Some people say, "Oh, I'm at home, I'll just skip it." But
exactly.
You can't do that.
A walker or a cane, whatever you've been prescribed, or you can see a specialist for that, because a walker and a cane increases your stability so that you won't fall over. And it's worth it, because if you fall over and you fracture a hip, that means is you're going to be it's a big operation, a big hit to your quality of life. So it's something that'd be great if we can avoid it.
I know climbing stairs was high on your list for helping for bone. And why is that better than walking?
Because when you go upstairs, you can increase the forces and loading on your bones, so that allows you to have more weight bearing, so that's better for your bones.
And I get, when people go up and down stairs, probably a good idea to use stairs that have a handrail.
That's a good idea.
Too. And to hold on to it.
Yes, hold on to it. It's not doing its job if you're not holding on to it.
That's right. And then people, if they don't have stairs, is there some way they can simulate that, step on I don't know, whatever, some books or something like that?
I guess you can always have like a bench and then just have something to hold on and just jump up and down the bench.
Oh, okay.
You can do that if you don't have stairs, or if you happen to have an extra, have a Stairmaster kind of machine, you can use that stepping kind of machine. You can. That's a way to do that. Maybe you can use that at a center, or borrow someone else's, or those are probably the best way of doing it. I like the machines because you're less likely to fall because you're supported, well supported.
Right. You want to hang on.
You want to hang on, and you have less to fall if you do.
That's right.
Trip up versus if you're going up and down stairs. If something isn't quite right, falling down a whole flight of stairs is unpleasant.
Can you summarize some things that you would like to leave people with, and maybe give them the website again?
Okay. Well, there's always something you can do for your bones. It's never too late to do something to help your bones. And you can help yourself by something simple from eating right, good nutrition, exercising, having good posture, to seeing your physician to have the right workup to make sure that everything is going the way you want it to go.
And when people visit their physician, they'd probably be a good idea for them to mention it.
Yes.
Because go in with a list of things that you might want to ask the doctor.
Yes.
Because the doctors can't remember everything.
If you write it down, then you'll most likely get it all down and then get all your questions answered, because it's hard when you're not feeling well, you're having discomfort, and you're seeing a physician to get everything down in the 5 minutes that you have to see them. So that's a very good way to do things.
Yes. Well, thank you very much,
Well, thank you for having me.
Luo-Tsng.
There's a myth going round town that when you get older you just sit down and start rocking. Just rocking. In a way that's true, if you know what I mean. Just take a look at the senior scene. Well, it's rocking. Yeah, it's rocking. We're pulling our weight, learning the code, clicking our heels, sharing the load, and every so often we're hitting the road. Yeah, we're rocking. Well, I must be going, got a game at 3, then kids to be tutored, they're counting on me. It's a brand new century, and we're rocking. We paid our dues all those years, and it's so nice to be switching gears. It's a grand new century, and it's the senior life, the senior life, the senior life for me.